Hello, my name is Wesley Willeford, and I'm the Deputy Health Officer of the Jefferson County Department of Health. And today I'd like to talk to you about tuberculosis infection. So let's move on and let's go over our overview of what we'll be talking about today. So firstly, we'll talk about what is tuberculosis infection. Then we'll talk about how does someone get tuberculosis infection. We'll talk about how common tuberculosis infection is. Can tuberculosis infection turn into TB disease? How do we diagnose TB infection? And we'll talk about how whether or not TB infection should be treated. And then we'll end with a summary of that information. So let's start with the first question. What is TB infection or latent TB? TB infection means that a person has been infected with the bacteria that causes tuberculosis, and we call that Mycobacterium tuberculosis. That's a scientific name for the bacteria. So with TB infection, a person does not feel sick and cannot spread the bacteria onto other people. But it's important that we compare that with another important term, and that is tuberculosis disease. When we say this, it means a person has been infected with tuberculosis and they feel sick and have the tuberculosis bacteria causing problems somewhere in their body. And they may also be able to spread it from person to person. Now I want to talk about this image that you see here before you, just to give you a better visual representation of that information. So latent TB or TB infection, you'll see on the left, and what you'll notice is a small circle on the bottom left part of the lung. That represents an area where the body, our immune system, has walled off tuberculosis infection and essentially put it in a cage. On the right, we'll see active TB or TB disease, and what that represents is the area showing what happens when that cage breaks down, when the TB bacteria begin to go to other parts of our lung and cause problems. So let's move on to our next question of how does someone get TB infection? TB infection occurs when someone with TB disease breathes, coughs, sneezes, and the bacteria in their lungs is put out into the air. Another person will come along and breathe that air in, and that starts the process. When when the tuberculosis bacteria are breathed into our lungs, what we see is the body can actually kill a lot of those bacteria, but it often is not able to kill every single one of them. For the ones that cannot be killed, what we see is the body walls off those bacteria and places them in a cage. While they're in that cage, they're not able to cause problems. They're kept in control. And so that's our immune system that's being able to capture them in this way. So let's move on to our next question of how common is TB infection. So TB infection, unfortunately, is very common. About 1.7 billion people around the world are thought to have TB infection. And with a population of 8.3 billion people in the world, that translates to about 1 out of every 5 people having TB infection. And that is a very large number of people. So next, let's talk about whether or not TB infection can turn into TB disease. And unfortunately, it surely can. TB infection does turn into TB disease. It happens to about 5 to 15 out of every 100 people who have TB infection. So not everyone, but a fairly large percentage of people. Whenever that transformation happens, whenever it goes from TB infection to TB disease, what we have is reactivation. And this reactivation usually happens about 2 to 5 years after being exposed to tuberculosis. So it can take a while, but when it happens, a person becomes very ill. So now let's talk about how we diagnose TB infection. TB infection can be diagnosed with two main tests. The first one is our TB skin test, which is an old and reliable test. What happens with it is a substance is injected under the skin, and we look to see if the body reacts to it. If the body has a reaction, that's a good indicator that the person has been exposed to tuberculosis in the past. The other test is our IGRA, or interferon gamma release assay, or IGRA test. This test is a blood test that basically is able to determine if a person has been exposed to tuberculosis in the past. Usually when we're doing this workup, we also get a chest x-ray just to make sure that a person does not have TB disease actively in their lungs. We want to rule that out before we start thinking about treatment. So now let's move on to whether or not we should treat someone who's infected with TB. And the answer is yes. If you have TB infection, we recommend that a person be treated for that. Why do we say that? So, firstly, the medications are safe, they're readily available, and they're very well tolerated. And we have lots of experience with those medications. Secondly, treating TB infection can reduce the chances of a person going on to have tuberculosis disease by up to 90%. That is a very large reduction, and that really helps to preserve a person and keep them from having this more severe consequence of tuberculosis. So, in summary, TB infections occur when a person is exposed to the TB bacteria. And while many of the bacteria may be eliminated by our body, some of them can persist and stay in our body. However, our body is able to wall them off and keep them contained. When a person has this TB infection, they really have no symptoms. They can feel perfectly normal, and they are not able to pass that infection on to other people. Unfortunately, TB infection can go on to become TB disease through the process of reactivation. And so, what we want to do is we want to prevent that reactivation. So, we will recommend TB medications to be given to a person with TB infection to prevent them from going on to have the much more severe and sometimes more debilitating TB disease. I want to thank everyone for taking time to listen to the presentation. I want to show you my references for my talk, and I'm looking forward to hearing everyone else's talks. Thank you so much.